Good afternoon or good morning to everyone on the line. I want to welcome you to today's webinar presentation. My name is Maria Nuesi and I am your host today. We're excited to have all of you join us for a presentation on COVID-19 and school mental health, how our district's responding. We are joined by a panel of experts who are going to share some insights and answer questions. But before we get started, I want to go over a few housekeeping rules. Today's session is being recorded, so do not worry about taking notes. We will send you a copy of both the recording and the slides after the presentation. During the presentation, you are in listen-only mode, so we will not be able to hear you. However, we have a lot of time for questions, so please use the interface on the right-hand side of your screen to submit your questions. So in addition to all of the topics and the questions that the panelists will answer in the next 45 minutes, we're also going to make time to answer additional questions. Finally, for those of you that are on social media, please feel free to connect with us on social media using the hashtag #CognitoWebinars. You can also ask questions through that, and we will be monitoring throughout the webinar. Next, I want to launch a couple of poll questions to get everybody on the same page and see where everybody is at. So the first poll question that is going to be showing up on your screen is, what is your district status as of today? Are you still open? Are you closed through April, closed through May, closed for the academic year, or closed until further notice? If you can quickly come onto your screen and share with us what is your current status for your district. And I will give everybody a couple more seconds before I share the results with everyone on the screen. All right, so the results show that the majority are closed through April. 48% of you are closed through April. Next is 25% is closed for the academic year. 17% are closed until further notice, and 2% are still open. So thank you for sharing with that. This will align with the Ed Week map that you'll see further down in the slides. We're going to move on to the next poll question, which is, has your district mental health services seen an increase in demand since COVID-19? And again, if you can just take a few seconds to share your response with us. Here we go. I see a lot of you are responding, and I'm going to go ahead and close the poll and share the results with all of you. So the results are 41% are not sure, 31% say that it's the same as before, and 21% says it has seen an increase in demand, but it's still manageable, and only 7% of you are seeing that it's over capacity, so which is great. So it sounds like for most of you, either things are staying the same, or if there's an increase, it's still manageable for all of you. So we're going to see how that is being translated to what we're hearing from our mental health experts and our district experts on the line. So with that, I'm going to hand it over to Jennifer Spiegler, who is going to lead the discussion for today. Jennifer, take it away.
Thanks so much, Maria, and thanks to everybody for taking time to join the call today. I am so honored to bring you these national and local experts from the National Center of School Mental Health and Fairfax County Public Schools in Fairfax County, Virginia. I am fully confident that you'll leave today's session with some great insights and ideas on how you can help your own districts navigate this extraordinary and unprecedented moment in our history. Before we get to today's conversation, I just would like to say a word about Cognito, the sponsor of today's event. Cognito is a national leader in online role-play simulations. We've worked with school districts across the country to build the skills of hundreds of thousands of educators and students in the area of mental health, trauma, suicide, and bullying prevention. To do this, we focus on conversations that move people to action, conversations that literally change lives. Our evidence-based simulations can be delivered alone or as part of a blended learning workshop that can be conducted either in person or fully online. If you're looking for remote PD or curriculum in any of these crucial areas, I do encourage you to sign up for a demo at cognito.com. Next slide, Scott. So here's where we are today. This is a map that was produced by EdWeek showing school closures. And by our count and those of our sources, school closures due to coronavirus have impacted at least 124,000 public and private schools and affected at least 55 million students. That is about 97% of all students and all schools. So it's not surprising to hear that so many of your schools are closed. We are coming to you, or I am coming to you. I'm Jennifer Spiegler, by the way, the Senior Vice President of Strategic Partnerships at Cognito, coming to you today from the epicenter of the coronavirus, New York City. We decided to host this webinar because of what we have been just hearing and dealing with our own districts out there in the world. As we try to find answers and ways to help everyone, we thought we'd bring together some experts to try to help us and to help you as we go forward into this extraordinary moment. Next slide, Scott. So our panel, and I am so happy to have them today, Sharon, Nancy, and Dee Dee. And if we can start with Sharon and have each one of you introduce yourselves, that would be fantastic. So Sharon.
Hi, everyone. Thank you so much, Jennifer. This is Sharon Hoover, and I'm a clinical psychologist and on faculty at the University of Maryland School of Medicine in our Division of Child and Adolescent Psychiatry. And I served as a psychologist in Baltimore City Schools for a number of years, and for the last several years have served as the co-director of our National Center for School Mental Health. We are funded out of the U.S. Department of Health and Human Services and have been in existence since 1995, and I co-direct the center with Nancy Lever, who I will pass it along to now.
Thank you, Sharon. Hi, everyone. This is Nancy. I co-direct the National Center with Sharon. I also serve as the Executive Director of the University of Maryland School Mental Health Program, which is a community-partnered school mental health program. And let me turn things to Dee Dee.
Hi, this is Dee Dee Baylor. Thank you again, Jennifer, for including me on this panel today. I am the coordinator of school psychological services for Fairfax County Public Schools. In my current role, I have supervisory responsibility for about 170 school psychology practitioners who serve over 189,000 students. In that role, I have the pleasure of working with local, state, and national government and agencies, public and private, to establish practices and policies to ensure delivery of mental health services to students. And Fairfax County is the 10th largest school division in the nation.
Okay, thank you. Okay, thanks so much. So I think you couldn't be in better hands here. We at Cognito have worked for many years with all of these panelists, and we know how well informed and cutting edge they are in the work that they're doing. So I want to start with Sharon, and just get a baseline here. How is the crisis, the COVID crisis, and school closure affecting student mental health? What are the districts that you serve seeing out there?
Right, so it's a good question, and I think we have many questions that are still not fully answered. We don't have hard data yet in some ways to know the true impact on student mental health, but we can draw some conclusions from what we've heard from partners across the nation, including many school districts we work with, and also just from what we know about children's mental health in the context of community and national crises. So we know, for example, that related to disruption in activities, uncertainty of the situation, fears about people that our students care about, fewer connections to positive adults and peers and activities. We're seeing some increases in worry and anxiety in some students, and certainly loneliness and sadness. We may also see increases in grief related to the loss of everyday connections and activities, as well as more significant losses, including major life events. Like we know a number of students are missing graduations or school events. Some are losing loved ones or time with loved ones, and those all may lead to grief. We know that trauma exposure may also be increasing. There's an anticipated increase in child abuse and neglect related to increased family stress, more time at home, challenging disruptive behaviors. And many are also anticipating increased depression and suicidality of students related to the myriad factors associated with COVID-19, including family stress and economic burden and social isolation, and also increased access to suicide means like firearms and medications in the home. And then all that being said, Jennifer, we also know that some students may not be experiencing as much negative impact, especially if certain support systems are in place. Some may even experience positive impact related to more time with family or fewer demands of school. So we know that the response in our students is likely going to be highly varied, but there is reason to be particularly concerned about student mental health at this time.
Sharon, are you surprised at the poll question that that districts, only 7% of districts said that their services were at capacity?
Not so much. It was an interesting response, but the truth is I think that so many systems right now are just in the stages of simply trying to navigate what the needs are, how to meet the demands, and how to really figure out the technologies that are needed to support their student population. So we have a lot of mental health support, for example, our school psychologists, and I know Dee Dee can speak to this, or school social workers, or school counselors, nurses, our educators who are eager to support the mental health needs of our young people, but may be prohibited from doing that because they're still just trying to decipher how they can do it in an equitable way, in a logistics, kind of working their way through the logistics of technologies. We're getting a lot of technical assistance support out to communities, but it still doesn't happen overnight, and I think speaks to kind of the need for better preparation in the context of these national crises.
Right. That sounds right. Dee Dee, where do you rank on this poll question? How would you have answered the question? Or maybe you did answer the question.
I didn't answer the question, but I agree with what Sharon has shared. I don't think we're there yet. I think we're going to see an increase in the demand for services. We have been out of school since March 13th. Our schools closed on March 13th. I think parents were getting first into the schedule and routine of taking over some of the academic responsibilities until we got our distance learning plan into place. So there were a lot of moving parts for families, and I think mental health wasn't at the forefront as much as it's going to come to be as people figure out how they're going to maintain their social connectedness, what their new routines look like, how they make those connections, and what their new family mode of operation is going to be. So no, we are working very hard to get our mental health supports into place, but we haven't had demand that we haven't been able to meet.
Great. Back to Sharon for a second. Can you talk a little bit more about the challenges of equity in this new environment?
There are many challenges related to equity that we're aware of, and I'm sure some that we're continuing to learn about. So a couple that come to mind. First of all, we know that a lot of the academic learning that districts are trying to achieve during this time are reliant on distance technologies, and that involves both kind of the wireless, cellular, or internet capacity, but also having the actual tools, whether it be tablets or laptops or phones. And many of our communities simply don't have access, whether it's because of their rural geography or other resource issues. And so we know that there are inherent inequities in terms of access to technology and to service. We also know that there are equities that we need to be thinking about with respect to students with disabilities, for example. And when we think about this in the context of school mental health, we know that a number of young people who experience emotional or behavioral difficulties have differences in how they need to access the learning content. And as schools and districts are putting into place academic distance learning plans, they have to be considering how they can do that in an equitable way. And I know a lot of families are uncertain about why distance learning, for example, can't happen overnight, or why their students aren't actively engaged yet in distance learning. And what we know is that it can take quite a bit of time to ensure that every student's needs are being served.
Yeah, I think that's right. We here in New York City, the city is fast scrambling. They got up and running in about a week, and there was everyday messages for, picking up laptops and dropping off laptops. And it seems like we have 1.1 million kids now at home on doing remote learning. How are districts being intentional about providing opportunities for social and emotional learning? So I think, getting the academic piece set up is like, that's how schools, schools are operating like academics first. And in fact, one of my colleagues, Don Bornheimer, shared a version of Maslow's hierarchy where actually doing schoolwork in this environment rises to the very top, and everything else, safety and shelter and relationships, need to be in place first. But I think, schools have scrambled to put that academic piece in place first and foremost. So aside from rolling out curriculum to kids and to families in this remote environment, how are districts, and let's put this over to Nancy. Nancy, how are districts
Sure.
being intentional about providing opportunities for social and emotional learning?
Well, this is definitely taking some creativity, and certainly not something that was anticipated prior to doing everything virtually. But we've seen some amazing responses across the country, and many of our districts are already figuring out what to do. How do you bring some of the social and emotional learning skills and strategies to the home? And we've seen people sending videos, sending resources to families to try and bring some of the same skills that were being taught into the classroom into the home. And families have appreciated having some of that strategies. And as Sharon mentioned, we've lost a lot of routines for our youth. So having the opportunity to see and hear some of those social emotional learning strategies that they were exposed to at schools can be really helpful. We also have the Collaborative for Academic Social and Emotional Learning, CASEL, has had a daily social emotional learning skill that they've been sharing on Twitter, and we have seen student instructional and support staff are doing social and emotional learning with schools, classrooms, small groups, and individuals using things through Facebook Live, Twitter, webinars, online learning platforms. But we certainly know that not all of our families have the technology, so some of this can be done by sending home packets to the family that include these skills. It could be through phone calls, trying to teach, sharing some of these lessons. And we have found, and people are saying that it's been helpful. And I do think the first response was to make sure we get our academics going, but this next wave is really thinking about the mental health and what can we do to support all students, not just our students who were already on our radar with mental health concerns, either through that they were receiving services or that they had an IEP. But we want to make sure this is a unique environment. We want to make sure that the strategies that we're coming up with are available to all students.
Fantastic. I think this is generally a period of amazing creativity. It's been really, I think, one of the silver linings of this is really to see how we react under this kind of stress, which this generation has just not ever known. So I think that's been a really interesting side effect of this situation. Dee Dee, how is the SEL piece playing out for you in Fairfax County?
Much the same way that Nancy talked about. Of course, it seemed our first major emphasis was on preparation of the distance learning plan for the academic side. But school counseling, school psychology, and school social work were working together to figure out how we could, through a virtual platform, infuse the social emotional lessons. So we developed a plan to take the school counseling lessons and the health and PE lessons that had to do with mental health and wellness and well-being, and identify a time in the learning schedule during synchronous or asynchronous learning where the lessons would be available, and the team developed 2 activities that the parents could do with their students to extend the content of that lesson. So if the lesson was about building relationships or establishing friendships or whatever the content of the lesson was for that day or week, if it was about relationships, how can you connect with someone in this distance learning environment? Write a letter, use social media, whatever it is. So they set up those lessons. And then our school psychologists and school social workers and counselors have been working with teachers to infuse social emotional content through use of evidence-based programs into whole classrooms. So to the extent possible, they're still working with the classroom teachers during their synchronous learning time to connect the social emotional lessons. They're not still doing coping CAD or a specific program, but they are working with the classroom teachers in a consultative capacity, which really expands the teachers' capacity to utilize the expertise of their clinicians during this time. So there are a lot of opportunities we have had in available to parents. A Healthy Minds blog, it's on our public website, and we've been putting up a lot of information there about extending social emotional learning during this period. We have made our Cognito friend-to-friend module available to all our high school students to expand that learning for them. We've also made the send out reminders to our community and educators that the other Cognito modules are available to them for their review as well. Just general reminders about the connectedness of what social emotional learning is. And this is a great opportunity to talk about social awareness, to talk about equity issues with students, to talk about how you maintain and build relationships in a distance learning environment, and how do you make responsible decisions? Because there were a fair number of folks who were not making necessarily good decisions about social distancing. So there are fabulous opportunities to take what is happening in our environment today into teaching social skills and teaching emotional skills to students to extend that learning. So we've really been using established lessons as well as pushing out content for application of today's life experiences for extending that learning as well.
Oh, that makes so much sense. I want to invite, we have so many people on the call from so many places. I want to invite you all to use the question function on the right side of your screen to ask us some questions. So I see there have been some coming in. And I'm going to ask Maria to help me sort through those. But in the meantime, while we're doing that, since you bring up teachers pairing with counselors and trying to support students and knowing what to do, you know, at Cognito, we spend a lot of time training teachers what to look for and how to be aware of students in distress, so students who are experiencing some kind of psychological distress or mental health crisis. Sharon, can you talk a little bit about, in this remote environment, what teachers should be looking for and how school mental health professionals can help prepare teachers for what to look for in students? You had mentioned in your first comment about, you know, home is not necessarily the safest place for students, and concerns for family violence, and in addition to the stress and loneliness and anxiety. So what should teachers be on the lookout for in this new environment?
Right, it's a good question, Jennifer, and we've heard from a lot of educators who are, again, both eager to support their students in a distance learning environment, but also have some concerns and might be nervous about what they might encounter and how to navigate that. As far as kind of what they should be looking for, as you said, Cognito and other mental health literacy programs emphasize looking for changes in behavior and functioning. And we would say you would do that now as well, although it might be hard to determine given that we know that there are other factors that are impacting behavior and performance. So it may be hard to judge some of those changes in behavior. Certainly, we would encourage educators to be on the lookout for statements of harm to self or others. But also it's a time for school mental health professionals to give educators some of the language that they can use to inquire about emotional and behavioral health status and needs of students. It may not be in the large class format. It may be that if they are connecting with students one-on-one, for example. So some questions about basic health hygiene, for example, how many hours of sleep are you getting? How has your sleep been? Your eating. Also things about their mood. How is your mood? They may introduce in their social emotional learning content, similar to what Didi was indicating, they may introduce something like a feelings thermometer so that there's a common language generated to describe how they're doing. They may ask about coping skills. So what are you doing to help stay calm and relaxed? And introduce some coping skills in the context of distance learning. And another question that we can equip educators with is who can you go to if you need help or support? And that can help teachers really identify which students do have somebody that they can go to and which don't, and encourage kind of help seeking. It's also important, though, that we equip teachers with a way to have a warm handoff, so to speak, so that if they do ask or if they do identify mental health challenges or other concerns in the home, they know what to do next. And we know that our partners in our schools, our school psychologists, social workers, counselors, nurses, and others are working hard to put those systems in place for support.
Great. Thank you. So I'm looking through some of these, and I want to follow back because things have come up. So one question that's come in, Nancy, you mentioned sending packets home to families. Is there a specific resource that you recommend? Also, this brings up the question of what to do with families with low literacy levels.
Great questions. You know, we have a lot of resources that we have available on our National Center for School Mental Health website, so schoolmentalhealth.org. We have them organized under COVID-19. There's a special tab for it. So there are resources on there. I do think you can look to see what it is you want to share. We are updating that every day and providing additional resources. I think it's a great comment about thinking about the literacy level, so making sure that the tools and resources that you're providing are appropriate for our parents and potentially directly for students. We also have had a lot of groups that are working to translate materials so that we have them available in different languages. So if you look at some of the resources that are available, make sure that you're providing them in the language that would be most relevant to your families.
The next question I'm going to direct to Dee Dee, and because I know that you work very closely with your local mental health agency, the Fairfax Falls Church CSB in Virginia. The question is, how can local mental health agencies best support teachers in this time?
We do have a very good partnership with our Community Services Board and our local mental health partners. One of our Inova Virginia Fairfax hospitals has opened up their therapy services to families on a sliding scale. They're taking more insurances. So we're partnering with them in that capacity. We also are doing some other things internally, and it might be an idea that you all could take and make application in your division using your own school-based clinicians. We just started today what we are calling Parent Clinic and Student Clinic, and it's an opportunity for parents to call in and schedule an appointment with a mental health provider, either a school psychologist or a school social worker, a 30-minute telephone consult, either for themselves or for their middle or high school students. We've run Parent Clinic and Student Clinic during the summer months when school is not in session, and we're absolutely stunned at how quickly the appointments filled up. The first year we offered it, we had 40 appointments. They filled right away. Last year, we provided over 400 parent clinic appointments for parents, and we had a waiting list. So we opened up our request for appointment line just this afternoon, and we're already getting requests for appointments. So parents can talk about their child is exhibiting signs of anxiety, or they think they might be depressed, and we provide them with materials and resources, and many of those resources include our community partners and include referrals for perhaps more in-depth treatment or consultation. So that network of partners is critical to the success of the work that we do in the schools.
Jennifer, this is Nancy.
Yep.
This is Nancy. If I could just add that one of the things that Dee Dee was just talking about is so fantastic, that they've offered an opportunity so students who may not have been on the radar of the system, who either they were already receiving services or receiving special education. I love that strategy really offers and opens it up to everyone, that new students can get referred into it. So it's a fantastic strategy that they're using.
Absolutely. Our clinicians reached out to every student on their caseload already. So those students are remotely connected to their clinician, as well as the teachers are reaching out, and the school counselors. But the psychologists and social workers reached out already to every student on their caseload. So you're right, Nancy. This gives, and then the interesting thing we found out was students who are reluctant to go to their school-based mental health provider are not as reluctant to go to someone they won't see in the halls of the school. So, but once they connect through Student Clinic, then they understand that going to their school psychologist or school social worker isn't scary. And when school resumes, they're connected back to their school-based clinician and know that they have that resource. And it helps parents. It gives the parents someone to call just for a consult. It's not a medical emergency necessarily, but it can help them get through that moment of concern.
I think that's right, because I think oftentimes parents don't realize that they too have access to school mental health. You know, it's like schools are such a kind of closed system somehow. So I think that's such a brilliant formula, the parent and student clinics. I have a question on the line here from, I feel like a radio producer or a radio host. Rob Schmidt in Talbot County, Maryland, is asking a question of Sharon and Nancy. Would you agree this unforeseen crisis would provide an opportunity to increase parent and therapist engagement via teletherapy within the school setting for parents, guardians not able to attend given work or transportation barriers? And I will just say, there's a whole, hour long that we could just talk about teletherapy, but Sharon and Nancy, can you answer this question for Rob?
Sure.
Yeah.
But Rob, it's great to have you on. We appreciate we've worked with Rob quite a bit over the years, and I do think actually our clinical program has been using teletechnologies all along, so it actually did make it easier when this occurred to think about how to expand it. So I do think it's going to increase some awareness of the possibilities of what you can do through telehealth. And I do think, there will be some of those to work with families who may not be able to come in for an appointment for very legitimate reasons. And let me turn it back to Sharon.
I would concur, and I think many are anticipating that this will be the impetus for a transformation in our healthcare system, and specifically in our school mental health system as well. We have long been using school mental health, and I know Rob Schmidt in Talbot County is one of our pioneers in school mental health and is working with a number of rural communities. And so perhaps a silver lining in this national crisis is that it may urge the system to move forward in terms of its acceptance of telehealth and the generation of policies and protocols to contend with privacy issues, technology issues, equity issues that all arise when we're in the context of telehealth.
Yes, I think. Thank you for that. I heard recently from a healthcare practitioner here in New York that in terms of equity, the reimbursement rate in New York is very, very different for telephonic versus video consults. I'm not sure if that's on the mental health side, but certainly on the physical health side. Do you know if that is true also on the mental health side, and whether that is something that might be changing? Because that would seem like a real equity issue, that some people don't have access to an audio visual system, but everybody has a phone.
It is an equity issue, and it has been for a long time. The reimbursement rates vary tremendously from state to state. And again, this may be an opportunity. We're already seeing a lot of movement within state Medicaid offices around how they are navigating telehealth in this context and telemental health. And I imagine there'll be quite a bit of advocacy to adjust reimbursement rates and to consider issues of equity.
This is Nancy. And in addition, there will probably be more considerations about which licensed providers would be appropriate to provide telemental health. In some places it is more limited to just the psychiatrists, nurse practitioners. So just it might give some pause to think about who could use this technology and use it well.
Right. Thank you. I want to talk a minute. We have some questions here around crisis. How are districts handling concerns, for example, for students at risk for suicide, Dee Dee, you and I had talked a minute on the phone the other day about training people to deliver the CSS, the Columbia Suicide Severity Rating Scale. Can you talk a little bit about how you're doing that in Fairfax County, not only with the tool, but addressing students at risk for suicide?
Yes, thank you. That's always a concern. It's a concern anytime you're meeting or interfacing with students, and especially now in this virtual environment, it presents more of a challenge. For us, the only virtual platform that's been approved by our school division for use is Google Meet for a one-to-one telephone conversation. So we don't have eyes on the student, which when you're dealing with mental health issues, seeing the student is sometimes critical to care and making your assessment. We've established a very tight protocol around what practice the clinicians will follow when they work with a student over the phone. If there's any suicidal ideation or any threat of harm to self or others, we have a threat assessment protocol as well. We have that all outlined. It is a little bit different from what our protocol was, of course, in the brick and mortar school, but we have revisited that and provided professional development to our responders. We do use the Columbia Screener in our school-based assessments. We have, again, our good relationship with our community and county providers, set up systems whereby we know who to call, who is staffed at what capacity during this period of time, and we feel like we have some pretty good safety measures in place for students.
Thank you. So there's a number of questions. We're rattling off a lot of resources, and I'm going to ask my team, Scott and Maria, to double back with our experts, and we will put together a list of some of the resources, Castle and others, and the National Center for School Mental Health, their COVID page, and some other of the resources that have been mentioned quickly here, so that you will all have those to rely on and to take a look at. And, you know, we're getting close to time here. So I think if each one of you could just take a minute and give us some closing thoughts as we all go back into this upside down world that we live in, I would really, really appreciate that. Let's start with Nancy.
You know, I think this is a time of, you know, we're seeing a lot of innovation, we're seeing a lot of collaboration, and there's so much that we can learn from one another with the many needs that our youth and families have. I think it's going to be more important than ever to make sure that we are sharing and communicating with each other so we can use the resources and tools that are developed to make sure that we're reaching as many, if not all, of our youth and families who need support.
Great. And then Sharon?
So I'll mention two things. One is I think that one of the primary things with respect to telehealth that we need to be attending to is just getting our provider community, our workforce, comfortable and competent with the skills to actually use the technology. And there are a number of resources that have been put out by our partners at the National Association of School Psychologists, school nurses, our American School Counselor Association. We also have a 45-minute tutorial on school mental health telehealth on our schoolmentalhealth.org site. So there are a number of tutorials out there so that we don't have to reinvent the wheel. And the second thing I want to attend to is just our educator well-being. In addition to the stress of trying to learn a whole new way of implementing education, they are now even more in a position of taking on the secondary traumatic stress of, you know, that they are experiencing with our students. And so I would encourage you to turn to our partners at the National Child Traumatic Stress Network. TraumaAwareSchools.org is one of their partners, the arms of the National Child Traumatic Stress Network. They have a whole free online training for secondary traumatic stress for educators. So a lot of good tools exist.
Thank you for bringing that up. I think, one of the things that we constantly hear in our work is how much beyond the education mission teachers are kind of responsible for now. And I think that that's right. This is a whole new world for teachers, and they're not only, I think, taking on traumatic stress of their students, but they're also living this crisis. And we've seen this before. We've seen it in hurricane stricken Houston, for example. We really need people to put their own masks on first. And let's finish up with Dee Dee.
I agree. In this time of unprecedented news and the pandemic, it's a time to come together as a community. And one of the other things that we've done is to invite our students to be part of the voice of the messaging of how we get through this together. And it's focused some of those seniors who were looking at a long, empty path to graduation, and now they're busy making videos at home, and we're working with our technology department to post those videos on our FCPS TV channel and through our YouTube channel, and they're just messaging positive messages to each other. Like, yes, this isn't how we planned our senior year to look, but here's how we can make the best of it. And one of the best messages that I liked was students saying to their parents, if you tell us we can't have sleepovers or we can't hang out with our friends, we're not going to like it and we might be mad at you. But if you explain to us that it's a national crisis and it's our responsibility as citizens to social distance and self-quarantine, we trust you and we'll do it. And it was so powerful to hear students messaging that to parents and then messaging it to each other. We've also created a platform where parents can send in ideas. One idea was family dinners, and someone else wrote in and said, I love the idea of virtual family dinners. She and her sister have birthdays within 10 days of each other. They planned special meals, both families dressed up, set the table, and virtually joined each other to celebrate their birthdays virtually. So there are a lot of positive things that can come out of this, family planning, doing meals together. And I think shifting some of the focus to that, what are some of the fun things you're doing? People are having dance parties, they're rediscovering board games. So providing the platform for community engagement and student engagement while we're supporting our teachers and one another, I think will get us through this.
I'm happy to end on a high note. Thank you so much. Thanks to everybody on the line. This is the first in a series of webinars, so please come back and join us. Thank you to Sharon, Nancy, and Dee Dee for sharing your wisdom. And we will send you a follow-up email that has these resources and, wishing everybody strength and courage and creativity in this moment. So thanks to everybody.
Thank you, Jennifer.
Thank you, Jennifer.
Thank you. Bye now.